Minimally invasive total body biolifting and bioresurfacing, revitalizing techniques and aesthetic regenerative anti-aging medicine. So yeah, I just put under the umbrella of biolifting and bioresurfacing a few techniques that I'm using in my daily practice as an aesthetic practitioner. So we do combine them to bring natural looking result with stimulation, collagen, and all those like natural processes that are ongoing in the skin and that we are fortunate to stimulate via injections of peptides, hyaluronic acid, and using all those different plethora of ways how we can really improve the life of our patients in a way and to help them to have peace of mind. So we know that, of course, aesthetic medicine is in all this humankind, like whether it was in ancient China or Egypt, like, or you tell me, people been doing and been using like different kind of methods, whether it was some plant-derived or animal-derived way of the skin rejuvenation, or possibly even surgery. But anyway, the aim was still the same. We want to, you know, just because skin is definitely a reflection of what we have inside, but at the same time, it's easy and primary stimuli of social connection. That's how we feel ourselves, and that's how people see us. So that is why it's like kind of important for most of us to look not as ugly as, like, you know, as possible. And however, here is kind of a rhetorical question, whether what makes us beautiful and what is beauty universal, or possibly it does change over time. It's been kind of a notion, you know, earlier, possibly about 30 years ago or somehow, like the beauty was more like culturally related. It had some link to a culture, but now we know that it's just beauty, and once again, understanding just the beauty, it's kind of that we can say that it lies in the eyes of beholder. So that's how people see us. And in many ways, so beauty can be seen as also as the reproductive factor, and that's how we kind of recognize people around. So basically it works as easy as it is, unfortunately. So we are still animals, and we are just picking up certain signs. So what really matters is like symmetry of the face, averageness of the face, and sexual dimorphism. And we are talking about sexual dimorphism. It's obviously like, you know, when men look at women, we are looking for some faceless, flawless skin, hairless, flawless skin, which doesn't have hair, which is basically a sign of like high estrogen level. When a woman looks at men, so it basically might reflect like if she sees some, like, you know, hair of the face. So this basically kind of reflect the testosterone profile of a man. So it has evolutionary basis there, definitely, and we still want to have this flawless skin. So indeed, aesthetic medicine is pretty much old thing, and it's like this aesthetic medicine is distinct from plastic surgery, since we are not using scalpel, but we are using different tools, and mostly our main tool and main rifle, if we can put it this way, is like definitely syringe, but of course we are using different methods of skin rejuvenation, whether it's some device like IPL, HIFU, or any other that can help us to make someone more beautiful. So patients definitely seek facial rejuvenation just because they want to look younger, but at the same time they're doing it just to have a peace of mind, just to get rid of, you know, some people who has some, you know, unfortunately that doesn't have enough hair. Someone does care, someone and trying to conceal it, someone doesn't. And but nevertheless, the common concerns that we people usually have because of skin aging, these are definitely wrinkles, loss of elasticity, volume loss, and aesthetics and practice of aesthetic practitioners definitely can help with the can help to get rid of these problems, or at least to maintain the skin condition. And I always say that like it's best approach is like when we can have a combination of those methods to support well-being, and at the same time, it's of course like when we can help to get rid of wrinkles, folds, and so on and so forth. Grow hair, it pretty much also help with the self-confidence. growing old, the face becomes serious, severe, and sad, but I would like to add O in between three of those S letters, just because like it's kind of give us a call: save our severe and serious face. So first, upon the first consultation, which is pretty important, like we have to understand like what we can do for the patient and in a way what patient can do for us. So we need to evaluate, assess the psychological profile of the patient to understand whether the demands that he or she comes with the we can finalize into something real in life. And like, of course, like upon this evaluation, whether we do some, skin measurement, whether we visualize it with the devices, or just look at purely at the skin condition. So we need to explain what are the possible options, and the important thing, of course, is like to have detailed documentation to fix everything in the progress, and photos before and after can help us a lot, and informed consent, of course, is a must. So aging of the face is the gradual process. We discussed it on the first day, but I'm just like reminding you that it's, of course, over years there are changes in the extracellular matrix, how cells are subject to for senescence. And so it just happens in connective tissue. We have some gradual loss of bone tissue, bone mineral density that leads to bone resorption. We lose some fat tissue, and so on and so forth. And some lifestyle factors like diet, smoking, and activity can only accelerate aging. And this is so it happens through a lot of those processes that you observe here on the screen. And in the ECM composition, we touched it on the first day. There are, of course, the changing of, there is a collagen fragmentation, and fragmentation of all the other proteins, same like it happens to the elastin, and that's a hypothetical model of the damage. At the same time, yes, what brings us to the changes like in the skin, of course, like it all happens down the deep changes like in a skull, in the bones, facial pockets changing. What we are aiming to do. So we want to bring some non-invasive, minimally invasive techniques for skin rejuvenation. I put it under the umbrella of biolifting, bioresurfacing. So biolifting mostly focuses on restoring lost volume, enhancing elasticity, stimulated collagen production, and bioresurfacing mostly addresses facial and body contouring and overall skin health. And here we're also doing some treatments to get rid of the pigmentation on the face. So what are the methods that we can put under this umbrella? So it's basically here I'm just reviewing something that we are doing in our daily practice, but of course some different methods, different ways of rejuvenation can be included. So in bioresurfacing I usually include a few techniques like so it can be endomology with LPG or any other type of vacuum massage, anything you like to use. So it improves circulation, lymphatic drainage. Electroporation, whether uses electroporation, whether with microdermabrasion or not. And here also we like to use a lot, whether it's IPL or HIFU, to bring all those dermal metrics to kind of change it in a way, so to bring more lifting and get rid of sagging and laxity of the skin. Vacuum massage. There are plenty of devices on the market, so you can use any of those. So basically what it does, it uses air suction to improve and compression to improve skin elasticity and can help you to, so we are boosting microcirculation. That's how it helps us to enhance fat tissue function and get rid of those lymphatic stasis, and can help us to get rid of cellulite and so on and so forth. And can be done also with it also works pretty good with additionally if you have some lymphatic drainage devices. What we are doing a lot for as well is aesthetic lipolysis. So also, like, you can possibly use different kind of lipolytics, but the one that I prefer, that's a combination of phosphatidylcholine, deoxycholic acid, that we in some cases, when the patient is too sensitive, we can mix with the lidocaine and then start to inject. But definitely it doesn't work for the people who have some excessive weight or they're just obese. We don't do it with the for obese people, with excessive weight. This can be done only for the small pockets of fat, anywhere from maximum from 100. Let's put it this way, from 100 to 500 grams of fat, and usually it can be a little bit of a subcutaneous fat tissue somewhere on the thighs, on the inner, on outer thighs, or somewhere on the belly. But just doing the treatment for the people who really has a lot of fat it doesn't worth it. So that is something that has to be done through the changing of the lifestyle and the diet. Please, could you help me to play the video so we can show how the lipolysis works? And this is one of the products that we have in a company, so it's VPTSRP aesthetic lipolysis. So we choose the area. In the presentation, I'm not usually touching much on marking, however, I will show it, but anywhere on the body, so that we do these injections of the lipolytics, it has to go through all the way to the subcutaneous tissue. Otherwise, like, if the needle is like usually less than 13 millimeters, it can lead to some necrosis of the tissue. So that's why it has to go deep. It has to go deep. But usually we can do this, we can introduce the medicine once in 2 weeks. It's usually a little bit painful. It has some tingling sensation just because once you inject it, the necrosis of the tissue starts immediately. So we don't advise to do for those people any kind of like physical exercises whatsoever, just because, well, they won't do it themselves, just because like it's a little bit overwhelming. However, the results come pretty fast, but once again, I emphasize that you couldn't do it for people with too much of the fat, just with the small pockets of fat. All right, so it's kind of like one of the best examples. You see, I'm not showing like anything extreme. Doesn't work in this case. Just small pockets of the fat, and so it's kind of, and it shouldn't. We can't do it on the body. We can do it on the face. Also possible. Electroporation is non-invasive approach to improve skin texture, and it's one of the ways how we can introduce any kind of almost any kind of aesthetic solution transdermally without having an invasion into the skin, even without injection. So this is kind of this is a device that's been on the market for a long time as well. And it helps to open the cellular membrane, it helps to increase the permeability of tissue, and plenty of patients, they like it since, it doesn't involve any injections, any pain, and so on and so forth. And the results can be pretty much decent, but at the same time, the bioavailability of the product is not as good comparing to the one when we have during the injection. So we can still help with the kind of tiny wrinkles like this, or it really works really well when someone needs to do someone wants to have kind of a splash of beauty on the same very day when you want to introduce some peptides, hyaluronic acid, whatsoever, and it's pretty much that doesn't have any downtime, which is great, and they can do it on the same day. I really like to do and use IPL in my practice, so intense pulse light. Use light pulses to target hemoglobin and melanin. That what can help to get rid of different kind of pigmentation. So you can use it in combination, possibly with, like in your practice, with RF microneedling and using different kind of peelings as well. I'm just like putting on the list like what else can be used for to get rid of the pigmentations. But I personally like intense pulse light. And so what's in biolifting? So it's a non-surgical approach, and here we use also different aesthetic solutions like hyaluronic acid and fillers, and aesthetic products like peptides. That's one of the best thing that how I see like natural results on the skin. Well, it's not just because like I have like easy access to it since I'm working for this company. Since I've been working in the market for the last 15 years, and I'm just like really like the natural looking results what the peptides can provide, and it's one of the best things that we have. However, so once again, with biolifting, we are also injecting hyaluronic acid in different layers on the skin. So we use gentle layer by layer rejuvenation of the skin, depending on the thorough evaluation of the skin condition, which of course provide hydration, volume restoration, and contouring. So we evaluate any case personally, like and individually. So if someone has like some problem with like nasolabial folds, of course we can introduce some more concentrated filler. And if someone has facial sagging, we'll need to use threads. So everything is evaluated case by case. With the superficial layer treatment, here we can use non-linked hyaluronic acid or some other products. It depending on, once again, on the case, what particular problem the patient has. So I've already mentioned it on the first day, and so basically two best products that we can use for the rejuvenation of the skin, and the third one is like exosomes, of course. So this either nanopeptides or mitochondrial peptides both work very well. However, nanopeptides, they're hypoallergic, they bring faster results, but they don't last as long. And with mitopeptides, I would usually, during the aesthetic procedure, I would prescribe it only for the people after 40 years old, just because the molecule is bigger, the molecule is bigger, it kind of takes longer time to absorb it. It retains slightly more water on its molecule and brings like the collagen remodeling for a longer time. However, once again, what is good about the NOP peptides, and we do have different combinations. So, for example, mesenchyme, it works NOP or mito-mesenchyme, it works really well for the wrinkles. If you talk about the skin peptides, they work and can help alleviate and make not that visible pigmentations. And placenta works really well either for the so placenta has all those growth factors, so it's a great agent for rejuvenation of the skin, regeneration of the skin, and first of all, it helps to decrease inflammation in any tissue. That's why it also can help to work with such conditions like, for example, like melasma, when there is inflammation in the tissue. And at the same time, placenta can help us to treat scars, stretch marks, and so on and so forth. So there are, and also we have a combination of all those peptides together with some large proteins like collagen and elastin to have even better results. So this is particularly the patient with some post-acne treatment. That's what Dr. Glenn did. And this is basically the result after only one introduced mesotherapy, which is wonderful. I already showed you this picture on the first day. Here you can see the result of the one mesotherapy on this hand, and you can still see some crust after the injections. That's I did in China once. So. And what we are doing with the middle layer treatment, so here we use low concentration linked hyaluronic acid and then inject it to the mid-dermal layer and target moderate wrinkles and skin laxity. And as well as we can introduce peptides. here are some results. You can see the complexion improves, the radiance improved. It can help to get rid of the wrinkles, and so on and so forth. But here I would like to mention that biolifting, biolifting doesn't only stop on the, doesn't only go to the face, but we can also do some rejuvenation techniques on the décolleté area, so basically on the cleavage, so something that we call breast pump. It doesn't bring, so we want to introduce a little bit of volume to kind of give a lift for a breast in this area. So some of the women, they like to do it. So first of all, first we are doing marking of the breast, and then we introduce the injection. So here we can use either PRP injection, so in most of the cases, and sometimes I do add the mesenchymal peptides for it. So when we are doing the marking, could you please play the video? Could you please play the video? So we just mark, we put a few a few dots. It's like, 4 dots like on any side. It looks like a zigzag. Then it's 5 to 10 ml syringe with PRP. Next video, please. Next video, please. We use some device that is vibrating to kind of to decrease the pain. Usually no anesthetic is needed. And then we are doing the injections. It's usually 5 ml per point with the PRP. So of course it's, this is pretty fast procedure, but it's kind of to take longer time for its preparation. So we don't go like too superficially, but from the point of injection, we go like little under. I can't all the way up. I can't tell you the exact depths, but like you can possibly see it like from the video itself, how it works. And yeah, definitely some vibrating helps for. Yeah, we don't go all the way like perpendicular, but rather when we pinch the skin, and we go kind of different. We go under the skin, but a little bit deeper. So it's kind of augmentation of the breast without and feeling of the breast without having any implants whatsoever. And this is one of the procedures that we also do. By the way, it was kind of not anecdotal case, but I usually I didn't believe to my own ears when I said that once within 3 days injecting peptides, Dr. Glenn introduced almost 200 ml of peptides to one person. So could you imagine how hypoallergic it is, including some intimate zones, rejuvenation, breast, and entire body. So that's what we call total lifting. And you can imagine so how hypoallergic these peptides are. And then the deep layer treatment, here we using high concentration link hyaluronic acid. It is absolutely helpful when patients have it's really good for the elderly or some people who are really losing the fat tissue, so to nasolabial, to fulfill the nasolabial folds or any kind of deep wrinkles, deep fine lines. And another way, and another thing that we do is also these are threads. So we're using surgical barb threads that helps to reposition sagging skin, and it's best works in combination. So. But let's put it this way. Of course, there's a heavy artillery methods when we are introducing the fillers or the threads. However, the peptides, they work for natural looking results, for improving for the skin radiance and for the skin complexion. So what are the benefits of biolifting? This is first of all, the patients, they like it since it's a non-surgical way of doing it. It has a minimal downtime. It doesn't really work for most of the patients who it is suitable for patients aged from 25 to 40 or who is slightly older, and it definitely helps to improve hydration, elasticity, and so on and so forth. And once again, it offers both biolifting and bioresurfacing offer minimally invasive solutions of facial and body rejuvenation. And when it's all started at the right time with the thorough evaluation, we can, the earlier the better, we can not only improve the skin condition, but also, as I said initially, to bring the peace of mind for our patients who just want to look more beautiful and handsome. Thank you so much.